Good morning all. I am Mrs. DEEPIKASHRee from the College of from the Department of Physician Assistant at the College of SNS Science, SNS Allied Health Sciences. So now we are going to say about the topic is pancreatitis. And now we are started with a case study. A 50-year-old male presented with a history of sudden onset of mid-abdominal pain radiating to his back. The pain awakened him at 4 a.m. in the morning. How will you diagnose the case? So this is the clinical manifestation. Now we are going to see about the introduction part of pancreatitis. The definition: the inflammation of the pancreatic parenchymatous is known as pancreatitis. Types: acute pancreatitis and chronic pancreatitis. The acute pancreatitis, it is the emergency condition, and chronic pancreatitis is prolonged and frequent lifelong disorder resulting from the development of fibrosis with the pancreas. The incidence: in the US, acute pancreatitis leads to 275,000 hospital stay per year. About 20% of these cases are considered severe. Chronic pancreatitis is less common and lead to 86,000 hospital stay per year. And now we are going to say about the acute pancreatitis. In acute pancreatitis, diffused pancreatic inflammation and autodigestion presents with abdominal pain and is usually associated with raised pancreatic enzyme levels in a body and urine. And the reversible inflammation of the pancreas ranges from mild to severe. This is acute pancreatitis, and the chronic pancreatitis is will be eventually do lasting damage to your pancreas, although it may take many years. Constant inflammation causes scarring of the pancreas tissue, that is fibrosis, which stops them from making enzymes and hormones. And now we are going to etiology of pancreatitis. So disease of the stomach, cholelithiasis, hereditary, unbalanced nutrition, inflammatory disease of the abdominal organ, abdominal trauma, hepatitis, and alcohol abuse. So these are the etiological factors of pancreatitis. High blood triglyceride levels, that is hypertriglyceridemia, inheritary gene mutation, that is hereditary pancreatitis, autoimmune disease, that is autoimmune pancreatitis, and decreased blood flow to the pancreas, cancer, and certain medication that irritates the pancreas. So these are the common etiological factors for pancreatitis. And signs and symptoms of pancreas. Abdominal pain from pancreas may be moderate to severe and may radiate to the back. It may feel worsen when you lie flat, cough, exercise, eat more. The additional symptoms of acute pancreatitis may include nausea and vomiting, fast heart rate, fast shallowing breath, and fever. These are the common clinical manifestations. And symptoms of chronic pancreatitis may include indigestion and pain after eating, loss of appetite, and unintended weight loss, fatty poop that leaves an oily film in the toilet, lightheadedness from low blood pressure. The complication: the acute pancreatitis, necrosis or infection, and pancreatic pseudocyst. For chronic pancreatitis, repeat episodes of acute pancreatitis can lead to chronic pancreatitis. The exocrine pancreatic insufficiency, malabsorption, malnutrition, hypoglycemia, hyperglycemia, type 1 diabetes, increased risk of pancreatic cancer. So these are the complications of pancreatitis. And the diagnosis of pancreatitis are glucose test, stool test, fetal fat analysis, and blood test. The treatment of pancreatitis is acute pancreatitis, IV fluids. Pancreatitis is dehydrating, and hydration is very important for healing. Tube feeding, parenteral nutrition, and a medical management, analgesic and antibiotics. The surgical management: cholelithiasis, endoscopic retrograde cholangiopancreatography, ERCP, the cholecystectomy, and some of the additional nutrition support will be given. And the chronic pancreatitis, distal pancreatectomy, that is the distal part of the pancreas is in a body and tail. A distal pancreatectomy removes the tail of the pancreas, and sometimes the body, if that involves too. The tail of the pancreas is closed, connecting to the spleen. A distal pancreatectomy often involves removing the spleen along with the tail of the pancreas. So this is distal pancreatitis. This is before surgery and this is after surgery. The distal part is removed. The central pancreatectomy. The central pancreatectomy removes the central part of the pancreas, leaving the head until the difficult operation is rarely indicated. So these are the introduction part of pancreatitis. Thank you all.